psychologists view most emotions the way you probably view pain, right? It's got a job to do. It tells us something's not right. Most of the time, it's a useful signal. Does it feel good? No. Is it purposeful? Yes. So the goal really is just to react and manage the feelings in a way that doesn't cause more problems, right? Doesn't actually lead to more difficulty. Um, but we have not helped ourselves at all with this idea that like somewhere out there is like emotional happiness that can just be achieved eventually.
Can you talk about I get a lot of patients who come, teenage girls who come with their mom to my office. And, from their affect, I can tell that, she's depressed, she's anxious. But every time I ask a question, the mom answers. I'm sure you've seen that. And the parents dismiss the symptoms of depression and anxiety in their teenagers because they're like, no, 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 in our family, we don't have this. Or no, 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 she's not anxious, she's just stressed. I don't think she's depressed. How do you how do you approach those parents and how do you treat those teenagers? Sometimes it's really tough when you cannot convince the mom or the parents that the teenager actually is suffering from
Mhm.
depression.
So I think there's two things that, but this is not going to cover all cases, but I think there's two things. First of all, the challenge with anxiety and depression is that people don't think of the symptoms as being symptoms, right? They mistake, a kid's sort of grumpiness or sadness or lethargy for like, well, that's just adolescence, right? So I think part of what we need to do as clinicians to say, actually, no. Like what we're looking at is a symptom of depression, and we have symptoms of depression, like we have symptoms of pneumonia. And I think I'm looking at a lot of symptoms, right? And helping people actually make that shift. And it's how people don't get care for their own anxiety and depression is they dismiss, these feelings as just like, oh, it's just I'm having a bad day, as opposed to recognizing a symptom pattern. I think the other thing that's really important to do is to help make clear to the parent that this is not about anything they've done or not done as a parent, right?